Here, here the ovary is in, it's white almond, and the fimbriae are the fingers, and then this is the infundibulum, and the bend here is the ampulla, and then this is the isthmus, and this whole tube is the uterine tube or the fallopian tube. Here is the uterus, and this is the fundus here, and then the endometrium is the most inner layer, which is depicted here in like a beige color. The myometrium is this meaty mass. That's all smooth muscle cells. And then it's the epimetrium?
Perimetrium.
Oh, perimetrium. The perimetrium is in beige here. It's the outer shell. The fundus is the bend here, and the body is the rest of it, the uterus. It would be like, what region is this? The cervix is the narrow bottleneck of the uterus.
External os and cervical canal.
Okay, the external os is the exit of the uterus, is the external os. The cervical canal is, you see how, the cervix pinches in? It's kind of squished here, but this is better. This is the external os here, the exit to the uterus. Here's the cervix, and this ribbed area, like you see how it's kind of ripply here, like the vagina is ripply here. This is the cervical canal.
So it's in between the cervix and the os.
Right. It's this canal is the actual passageway. The external os is the exit. Okay, and the cervical canal is going through the cervix. Okay, the uterus is often called, it's like a pear shape, and it kind of bends, and it bends forward. So the fundus says, "Hey, how you doing?" And it's going to the front. How you doing? And then the cervix is the end of it, and the cervical canal goes through it, and then the external os is the exit. And the fornixes are the corners of the smile here, these little indentation, and then this is the vaginal canal or vagina. What should you call it? Vagina?
Yes, just vagina.
Right. Now, if we look it up, I'm pretty sure this whole sheet is the broad ligament, and I get confused. I think this is the round. Wait a minute. There's the ovarian ligament. I bet this is the ovarian ligament underneath the. You're right. That's holding the ovary. So that's the ovarian ligament, and this must be the round ligament. This is the ureter. And people confuse those two things. This is the round ligament, and look, it's attached to the uterus. This is going toward the bladder in the front.
So is this the ovarian ligament here?
Yes, in white. Yes, that white tube is the ovarian ligament.
Ovarian ligament.
Yeah, this model they use for all the ligaments.
Okay.
So the ovarian ligament going to the ovary, the round ligament goes to the uterus, and then the broad ligament is this whole sheath area between the uterus and the ovary, holding in place.